Once a baby is stabilized with intracranial hemorrhage or intraventricular hemorrhage, the baby will get out of the hospital at the same time that it normally would for such a premature baby. If the baby is stabilized, it can take food well, and eventually can nipple and drink from a bottle, the baby's going to go home at the same time that other babies would at that gestational age. Some babies will develop complications from intracranial hemorrhage. These occur because the blood sometimes clots in the ventricles and it occludes the normal flow of cerebral spinal fluid into and out of the ventricles. This can actually cause a buildup of spinal fluid, and it can cause the brain to swell. And when that happens, the baby can have symptoms like seizures or lethargy. And in fact, if it goes on long enough, the head can start to enlarge. So with some of the bleeds that are more severe, the neonatologist will tell you to watch for certain signs and symptoms like I've described. With the more simple bleeds, that's not going to be the case. Now, most neonatologists will continue to follow all babies who have had an intracranial or interventricular hemorrhage for several months so that those babies can be checked out for head growth, for body development, for neurologic involvement. And that occurs in what most neonatal units call the neonatal follow-up clinic. That usually takes for about a year until the doctors will dismiss you from that clinic. Also, you will be observed by your pediatrician during that first year. So you'll have two sets of eyes looking at the baby and making sure that everything is going well. As I said before, most intracranial or interventricular hemorrhages do well, but there are some that will have problems, and you'll be instructed on that by the people who discharge the baby from the hospital.